Welcome to this explainer, where we're diving deep into the true medical reality of migraines. Now, if you or someone you love deals with these, you already know they can be an absolutely debilitating condition. Yet, somehow, they're still so widely misunderstood by the general public, right? So today, we're going to unpack exactly what's going on in the brain, how to spot the early warning signs, and most importantly, how to take back control. Let's get into it. I want to kick things off with this incredibly powerful quote from Dr. Amal Starling at the Mayo Clinic. She says it is not just a headache, it is a genetic neurologic disease. We really need to eradicate this whole I'm fine culture, invalidate what sufferers are actually going through. We are talking about a complex genetic neurologic disease. It's not just a bad headache you can simply push through or distract yourself from. And honestly, the sheer scale of this disease is massive. Migraines affect an estimated 12% of Americans. To put that into perspective, over in the UK, that translates to about 10 million people. That is a huge chunk of the global population dealing with a severely disruptive, recurring condition day in and day out. Now, looking at the demographics, women are hit particularly hard. About 1 in 5 women experience migraines, making them 3 times more likely to get them than men. This is largely driven by hormonal differences. Think fluctuations in estrogen around menstrual periods, pregnancy, or menopause. But hey, it doesn't stop there. It also heavily affects 1 in 16 men, and surprisingly, 1 in 11 children. Yeah, kids get them too. So, here's a crucial piece of the puzzle. This condition is largely hereditary. Up to 80% of people with migraines have a first-degree biological relative who also has the condition. Because it's a genetic disease, if a parent has it, there's a literal coin toss, a 50% chance their child will inherit it too. It's quite literally wired right into your DNA. The 4 stages. Let's look at the timeline of a migraine attack. To really grasp what a sufferer goes through, we have to track the entire lifespan of a single migraine. It's not just the moment of pain. A single episode is a full systemic event that can span hours or even days. It moves through 4 distinct phases: Prodrome, aura, attack, and finally, Postdrome. Let's zoom in on that very first stage, the Prodrome phase. Think of this as your body's subtle warning system, which can actually kick in up to 2 full days before the head pain even starts. People often experience symptoms they wouldn't even think to connect to an upcoming migraine. We're talking unexplained mood changes, from feeling super depressed to suddenly elated, weird food cravings, a stiff neck, constipation, or even just uncontrollable frequent yawning. Then, for about a third of sufferers, the aura phase hits next. An aura is basically a set of temporary, reversible neurological symptoms acting as a major red flag. Mostly these are visual disturbances. You might see flashing lights, bizarre geometric shapes, or even blind spots. But it can also be physical, like feeling pins and needles in your arm or leg, or suddenly having trouble speaking. This usually goes up over a few minutes and hangs around for anywhere from 5 to 60 minutes. After that, the brutal attack phase begins. If left untreated, this nightmare can last anywhere from 4 to 72 hours. It's characterized by this severe, throbbing, one-sided head pain. But it's not just the pain. It brings along an extreme, totally debilitating sensitivity to light, sound, and sometimes even smells and touch. This massive sensory overload is usually what triggers the intense nausea and vomiting that so many people experience. And finally, even when the actual head pain fades, the whole ordeal isn't exactly over. Welcome to the Postdrome phase, which a lot of sufferers accurately call the migraine hangover. This phase basically leaves you feeling completely drained, confused, and just entirely washed out for up to a full day, very much like a severe alcohol hangover. Even a sudden head movement might bring a flash of that pain right back. Understanding your triggers. So, while your genetics might load the gun, it's specific environmental factors that actually pull the trigger by altering nerve and blood vessel signals right in the brainstem. And these triggers, they are highly personal. You've got hormonal triggers like sudden drops in estrogen, sensory triggers like bright flashing lights or overpowering perfumes. Dietary triggers are huge too, things like red wine, aged cheese, MSG, or literally just skipping a meal. And of course, lifestyle triggers like high stress, shifting weather patterns, or a bad night's sleep. Honestly, keeping a diary to track your unique triggers is an absolutely essential step in fighting back. Medical treatments and relief. Right now, there isn't a permanent cure for migraines, so medical management focuses on 2 entirely different game plans. First, we have acute or rescue treatments, things like triptans, japants, and standard ibuprofen. You take these the second the headache starts to try and stop an active attack in its tracks. The second approach is preventative treatments. If you get migraines frequently or they're super severe, you take these daily or monthly to dial back how often may attacks even happen. This includes options like beta blockers, Botox injections, and the newer monoclonal antibodies. But listen, there is a massive trap here that we absolutely need to talk about: medication overuse headaches. You have to be super cautious with those acute rescue meds. If you're taking standard painkillers for more than 14 days a month, or triptans for more than 9 days, you could actually trigger a rebound effect. You can get trapped in this agonizing repetitive cycle where the medicine itself starts causing the exact symptoms you're trying to escape. It's also completely vital to know when a headache crosses the line into a real medical emergency. You need to seek immediate help if you ever experience a sudden, severe thunderclap headache, a headache paired with a fever or a stiff neck, sudden confusion, vision loss, unexplained numbness or weakness on one side of your body, or any new kind of headache pain that starts up after age 50. These are major red flags, guys, and could signal life-threatening issues like a stroke or meningitis, so never ignore them. Lifestyle and prevention strategies. Zooming out for a second, your daily lifestyle choices can dramatically empower you to keep those triggers in check. The Mayo Clinic recommends this fantastic, highly actionable approach called the SEEDS method. S is for sleep, stick to a really consistent routine. E for exercise, start small but get moving regularly to make it a habit. D is for eat, focus on healthy, balanced meals and stay hydrated. D is for diary, track your migraine days to spot hidden patterns so you can share them with your doctor. And the final S is for stress, manage it with mindfulness, therapy, or biofeedback. Sticking to this method helps build a resilient routine that seriously keeps attacks at bay. And alongside the SEEDS method, a lot of sufferers find real relief using natural alternatives. Certain supplements like riboflavin, which is just vitamin B2, magnesium, and coenzyme Q10 have shown some pretty amazing promise for prevention. Alternative physical therapies like acupuncture can also be incredibly soothing and helpful. Obviously, you definitely want to explore these under your doctor's guidance, but they are fantastic complementary tools to have in your toolkit. Well, that brings us to the end of our explainer today. Look, migraines can be deeply, deeply disabling, but by ending the stigma, recognizing these symptoms early, and using these medical and lifestyle tools, you really can fight back. So what is your first step to taking that control today? And if you're lucky enough not to suffer from migraines yourself, how will you use this information to support the sufferers in your life? Thanks so much for joining me, and I hope this knowledge empowers you to live a healthier, far more informed life.